I think that's working. Some questions about the syllabus quiz. You should be taking that on your own. You can use the syllabus. My intention with the syllabus quiz is for you to, it's essentially a check to make sure you've read the syllabus. It's right here on the front table, Tim. Check to make sure you've read the syllabus, get it done anytime between now and Friday. You got to get 100% on it. I don't think, gosh darn it. I don't think that should be an issue for most of you all. Shouldn't be an issue for most of you all. Yeah, the next quiz that we're going to have is at the end of this quote unquote unit, at the end of this introduction unit. We're going to talk about what is in here. Tissues. We're going to talk about typically soft tissue in this lecture. We're going to talk about bone tissue in the next lecture. We'll have a review and then we'll take a quiz. Any concerns about the timing of the first quiz? You should also note that essentially if I star something, it's probably going to be on the quiz. So if you want to prioritize what you're writing down or prioritize your studying, I will help you in that manner. Any housekeeping questions? Any content questions from last time? All right, let's jump into tissue level of organization. So there are a couple of different levels of organization. Remember that pyramid that we have? We're looking at tissue. So when we're looking at tissue, we can look at it under microscopy. Here we can see some normal connective tissue from cancer cells. Quite interesting. Yes. Moving on. The main stuff we're going to be talking about is connective tissue. So within the body, we have a couple of types. We have nervous tissue, obviously for nerves. So that's how we feel. So this is feeling. Epithelial tissue, it's in skin and organs. So skin, organs. Muscle tissue, there's 3 types of muscle tissue that we'll go over. Cardiac, it's in the heart. Smooth muscle is going to be more in our internal organs, digestive system. And skeletal muscle is our big muscles, biceps, triceps. Everything you think about when you think about like a bodybuilder, all of the muscles that help you move. So a skeletal muscle does. And then we also have some connective tissue with fat, other soft padding tissue, cartilage, and then we have some bone connective tissue, and then tendon. So if we zoom in real big on this picture, we can see tendon kind of right. Oh, I can't make it any finer. Oh well. Oh, let's see. Let's see how fine this gets, eh? Oh, there we go. That's fine. So this outline. There's some tendon, and then it looks like this right here is the muscle belly. And then we will have more tendon right here. The main feature of tendon that we'll see, tendon is tendon. You can distinguish tendon from muscle by first the color, although most of the time we're not going to be able to see color on if we're assessing a patient, say, but you will be able to distinguish muscle from tendon because tendon connects muscle to bone. And then I deal with primarily most of the patients that I see in clinic are coming for muscle injury, tendon injury, or ligament injury. The difference between tendon and ligament is tendon connects muscle to bone, ligament connects bone to bone. All right. And these, close this up. These types of tissue will be need to know. All right, and so then we're going to talk about some epithelial tissue. Epithelial tissue is more of our connective tissue. Connective tissue, and we can have epithelial tissue that is in a single layer or multiple layers. So our simple squamous epithelium is going to be this one in the top left-hand corner. This is mainly found in blood vessels and body cavities. Blood vessels. And then we have stratified squamous epithelium. Sorry, so stratified squamous, I think of squamous first. I think of squished, looks a little squished, a little flat. Tim, question. I got no idea what squamous means. About epithelial? I will try and do that for next lecture and going forward. Thank you for that. So stratified epithelium being that type of connective tissue, stratified squamous. You are going to mainly find this in skin and anything that contacts the outside world. So, yes. Skin, right? So if you think about skin and it's multiple layers, and then you'll shed skin over time. And so we have to have multiple layers in order to maintain that barrier from inside and outside. Cuboidal, or looking like a cube. This is simple cuboidal. First, that single layer cube-shaped cells found in gland tissue in kidneys. Glands and kidneys. Stratified cuboidal. We're going to find these in sweat glands, mammillary glands, salivary glands. Can anyone tell me where salivary glands are found? Yep, so they're in your mouth, right? Saliva, salivary. So that saliva will help. Hold on here. So we got sweat, salivary, sweat and salivary. So that saliva is going to help us break down the food, help separate the molecules in order for us to be able to digest that. And then We have columnar epithelium. Simple columnar. We are going to find these mainly in the digestive tract. And so what you can see right here on this picture, you can see these little fibrils right here. That's going to help the tissue expand the total surface area in your digestive tract. So when you're digesting food, your intestines are churning it and trying to extract the nutrients, the more surface area you have, the more you'll be able to have those connectors and receptors on the outside of the epithelium in order to take in those nutrients, right? And so if we have very tall and wavy top part that's contacting the food, it's going to have a lot more surface area versus if our intestines were as flat as this table right here, there's going to be a lot less surface area for us to digest that food. So this is digestive tract. Digestive tract. All right. And then we have stratified columnar epithelium. Stratified columnar, we're going to find these in our eyes, urethra, and pharynx or throat, or excuse me, nose. So this is eye, pharynx, and urethra. Yep, urethra. And then columnar also has this last category, pseudostratified. When looking under microscopy, pseudostratified epithelium may appear stratified, but in actuality, it isn't stratified. And you're going to find this in your respiratory airway. And once again, it has these little fibrils right here. And the purpose of those fibrils in the respiratory airway is similar to the fibrils in the digestive tract, except we're trying to capture particulates, dust, foreign pathogens, and then the body will take those and they will either force them up into your nose and you'll sneeze them out, or they will go into, I'm gonna hold off on my last slide. They definitely will force them up in your nose and you'll try and sneeze them out or cough them out. All right. Any questions on types of epithelial cells? All right. Wonderful. Eye, pharynx, P-H-A-R-A-N. Where is it? Columnar, P-H-A-R-Y-N-X. Wow, I totally spelled that wrong on here.
On the side of the book, there was a word under the left corner.
Left corner. Skin?
Yeah, sorry.
You're good. Skin. All right. We will keep going. All right. Now we have a little bit more connective tissue proper. So when we look at kind of raw, quote unquote, connective tissue under microscopy, it looks a little different. And so we have a couple of different types of fibers in here. So we have reticular fibers, R-E-T, this needs to be smaller. Reticular. Reticular fibers. Reticular fibers, they're going to be a supporting mesh for soft tissue. So kind of think of it as a little bit of scaffolding in the body for us to be able to build other connective tissue, other types of tissue in the body. Those are reticular fibers. And then we have adipocytes, adipose tissue or fat tissue. That's going to be storing energy, fat storage. You will find these typically, most easily, you will find these right below your skin where we store a lot of, it's called subdermal fat. And so that's fat just right below your skin. And then we have mesenchymal cells. That's a big word. MESENCHYMAL. Mesenchymal cells, these are going to be stem cells. They're found in bone, and they help make skeletal tissue. Isabel.
Is it adipocyte fat itself, or is it like storing in the form of fat?
Sure. I would think of adipocytes as if we have a container, like Michaela's Cheerios container right there, that's the adipocyte, and then we put the adipose or the fat in the container.
Thank you.
All right. We have mesenchymal cells. Now we have elastic fibers. Elastic fibers. These elastic fibers, they're going to allow stretching, flexibility of tissue, right? So we don't want all of our tissue to be very firm and rigid, right? Because if all of our tissue was very firm and rigid, particularly in our skin, right? I wouldn't be able to bend my hand. I wouldn't be able to move, and we wouldn't be able to have some elasticity or some give to some of these tissues, right? So by having those elastic fibers, they allow that little bit of give, but not so much to make us into, a non-supportive structure, but just gives a little bit of stretchiness, kind of like maybe in clothes, right? They might add in a blend of elastic into clothes to make them a little bit more stretchy and pliable. And then we have collagen fibers. AGEN. Collagen fibers. These collagen fibers are a little bit stronger. They're found in skin, tendons, and ligaments. Collagen fibers help in connective tissue. Collagen is the kind of main load bearer. That's what I'll say. It's going to help support the rest of the connective tissue, help be that structure within the connective tissue. All right. Then we have fibroblasts. FibroBlast. Fibroblasts. Fibroblasts, these are going to help build the structure and help in wound healing. So when continuously your body is consuming old tissue and producing new tissue. So about every decade, the cells that you had, so let's say, going from age 10 to age 20, you have none of the same cells that you had when you're 20 as when you were age 10. And so your body is constantly repairing, regenerating, and making new and getting rid of old cells, whether it's in bone, tendon, ligament, muscle, you name it, it's getting put in and taken out. All right, and then the last one on this slide right here are macrophages. MACROPHAGE, macrophage. Macrophages are white blood cells. They digest pathogens, tumors, other foreign substances. So these are going to help us out with staying healthy and making sure that some waste substances or foreign substances that are in our bodies are excreted. All right. Any questions on any of these fiber types? Tissue types.
There's some mesenchymal cells here.
Mesenchymal cells, they're stem cells that are in bone, and they're used for making skeletal tissue. Theo.
What those fibroblasts?
Fibroblasts, they build the structure. So think of I'll take the example of when you get a cut. Okay. Fibroblasts, what are going to do? They're going to come into the area of that cut and they're going to lay down tissue, and that tissue eventually will be eaten up by other cells to be formed into collagen. So they lay down, between, let's say, the time that we're getting a bit ahead of ourselves. You should just know for right now, they help build a little bit of structure and kind of help guide the new building of tissue.
Is that a type of white blood cells, or are all white blood cells?
I think you're right that it's a type. I don't recall off the top of my head because this is like we do like one section on cell stuff, and then the rest is like big stuff. So that I will find out from Mr. Tafur or Mr. Saunders. Anything else before we move on? All right. Moving forward. Adipose tissue. So adipose tissue, as I alluded to earlier with Isabel's question, we have adipocytes, and then we have the stored lipid or the stored fat. And then you can also see that nucleus and cytoplasm in that adipocyte. So, right, we are right here with that nucleus and cytoplasm. And then we got all the fat in here. And then we have the vessel or the cup that we're containing that fat in the adipocyte for the whole thing. All right. On the left is a drawing, and on the right is what it looks like under microscopy. Okay. I'm going to go back here. This one, if I recall correctly, that's on there. Reticular fibers. Reticular fibers. So these are those loose connective tissue, provides that supportive framework. Fiber type. Okay. Articular tissue. So then we're gonna get into dense connective tissue. And this is where it gets a little fun. Dense connective tissue. You're gonna find in tendons and ligaments, so regular dense. So this, see how, set here. Tendons and so we have tendons and ligaments. You can see how it's mostly, for the most part, if we take a look at this illustration, it's mostly straightish. We have a little bit of waviness, but in general, they're pretty straight. They're pretty, they align in a fairly straight pattern, align parallel with one another. Comparatively, irregular dense connective tissue, if we were to use this for a tendon or a ligament, it might not hold up so well. And so the body doesn't use it in tendons or ligaments. It uses it in the skin, in some tissue surrounding the spleen, and the liver. So this irregular dense is more mesh-like network, whereas this regular dense tissue is more parallel bundles. Different types of tissue for different jobs that needs different requirements. Right? Tendons and ligaments, irregular dense, skin, and some tissue that surrounds the spleen and liver for dense irregular. All right.
Oh, now
Now we're getting into cartilage.
Can
Can someone tell me where I might find cartilage?
Say
Say again,
again,
Theo?
in your
In your
nose.
nose.
Yes.
Yes,
You'll
we'll
find
find
some
some
cartilage
cartilage in your nose.
Ears.
Ears.
Yep.
Yep.
Ears.
Ears.
Anywhere else?
Anywhere else? Tim, what'd you say? No, you will not find cartilage
in
in a penis.
Anyone else?
Anyone else? What about in your knee? Fingers? Where in your fingers? So, there are a couple of different places where you're gonna find this cartilage. So hyaline cartilage, this top one right here,
You're
you're gonna find,
we're gonna do
we're gonna
this
do this in blue.
You're
You're gonna find this on joint surfaces.
And what
And what I mean by joint surfaces, surfaces, joint surfaces, anytime two bones touch each other, we're gonna need something to be kind of that, have a low friction between the two bones, right? If we just have bone on bone, you're gonna run into inflammation. It's gonna be a lot of friction in there, and the body's not gonna like that, right? Just like when the wheels on a car spin, we need some. You can't have too much friction. And we optimally want sliding. That's not a great example. What's another example? When you're sliding in your socks on a hardwood floor. Has anyone ever done that? Have hardwood floor sliding on your socks? The reason that you're sliding on your socks is because there's a lower coefficient of friction. And so when you have that lower coefficient of friction, you're more easily able to have those two surfaces glide along each other instead of having a greater amount of friction where you wouldn't be able to slide on it. So, can't slide great on carpet in your socks, but you can slide pretty well on nice flat hardwood floor. That coefficient of friction. All right, next one, fiber cartilage. Fiber cartilage, you're gonna find these in the discs of your spine, called your intervertebral discs. Intervertebral discs. Those intervertebral discs are gonna have some shock absorption, and once again, try and help you to not have bone-on-bone rubbing. You're also gonna have these in menisci. So in your knee, MENISCI, menisci. You will, so in your knee, menisci, they act as somewhat of a shock absorber in your knee to help buffer possibly that force when you take a step so that it doesn't get translated all the way up into your hip and through your spine. It takes a little bit of that shock and absorbs it a little bit. And then we also find this in bony grooves. Bony grooves. You can think of if you want to feel on your medial side of your elbow, your funny bone, right? You can feel the most prominent portion on your medial elbow is your medial epicondyle. If you go just posterior to that, and push real hard, you can get a tingling sensation. That's where your funny bone is. Let me come around. See if we feel it. So. Right in there. All right. So now that you all have felt your ulnar nerve in its groove, there's some fiber cartilage there. And also in some other bony grooves that we'll go over eventually in class. And then last one, the one that you all kind of identified is elastic cartilage. You find these in ears, nose, all the ears, nose. You find elastic cartilage. Provides some firm support, but you have some strength and has that elastic property. Being able to, so if we think about a rubber band, you can
take
take a rubber band and stretch it out. And then if you give back to it, it can still return to its original shape, right? That's an elastic property.
All
All
right.
right.
Fur approach.
Now we got blood.
A
A lot of people don't think about blood as a connective tissue, but blood is it's a fluid connective tissue. Contains leukocytes, erythrocytes,
various
cell types that I don't recall, and I'm not going to test you on. But blood, somewhat of a connective tissue, contains some of these fiber types, and when you say cut yourself, get cut, you will the blood will carry some of these fiber types to that injured area and help to repair that tissue. Alright. Muscle tissue.
Before we
Before we
move
move on,
on,
any questions about some of this connective tissue?
All
All right,
moving
moving
on.
on.
Muscle
Muscle
tissue.
tissue.
We
We
have
have three types of muscle tissue. We have skeletal muscle.
You
You can think of
this
this as your big biceps, triceps, quads, any muscle that you can think of that helps you to move. Skeletal muscle is going to be that muscle that's helping you move. Smooth muscle, you're going to find that in walls of the digestive tract. They have single nucleus, no striations. Striations being these. So you can see striations in the skeletal muscle, this white stuff right here. Those are striations. No visible striations. Single nucleus. And a lot slower contraction speed. Right? We don't need our intestines to move at the speed at which, say, we need to kick a ball, for example, or swing a bat, or what other sports are in here? Shoot a basketball. We don't need them to do that. Otherwise, it might be very painful. I don't know about you. I wouldn't want my intestines contracting like as fast as my heart or something. That would be painful. All right, and then we have cardiac muscles. Cardiac muscle, they're striated, they have a single nucleus, and they're found in the heart. That's why it's called cardiac muscle. And then another one other thing that's particularly special about cardiac muscle is that it can conduct its own contraction. So what do I mean by that? Typically, skeletal muscle, smooth muscle, they are innervated or served by nerves, and those nerves will send a signal to the muscle that allows the muscle, or will trigger the muscle to contract. Since sometimes there can be hiccups, the body has built in a backup system. And one of those backup systems is that cardiac muscle is able to generate its own electrical impulse in order for it to contract. So literally, if this can happen, you can have someone who is not alive, you pull out their heart can still be contracting.
without being attached to nerves. So that's one of the backup systems that is built into body. Any questions on muscle tissue types?
All
All
right.
right.
Neurons.
Neurons,
My
my
favorite.
favorite.
Neurons.
We, there are a couple of different parts
that we
that we gotta look at here.
Basic
overview.
We have
We have the nucleus right here,
Nucleus
nucleus of
the
axon,
or
or
nucleus
nucleus of the neuron.
Excuse me.
And then we also have these dendrites right here. So these small tree-like branches, those are going to be connected to other neurons. And so it will allow that that conduction of an impulse to be transmitted across neurons. And then we have, we're going to do a different color here. Let's do this light blue. This long part here, the axon. So once we have a axon, this long body of it, and then we have dendrites on the other side to connect with other neurons. So then once we have a once we have
a
nerve impulse and it is transmitted to one of these dendrites of this neuron, it's going to send it. This neuron will take that, will trigger a chemical response. Take that, and that nerve impulse will travel down the axon and then attempt to trigger a nerve impulse in another neuron. Yeah, I guess. Let's do a different color. It will. Is that better? Let's make this a little bit bigger. Travel down the dendrite, go and trigger that response, and that nerve impulse will travel down the axon and try to trigger a response from another neuron. Very basic. Isabel.
So is the way that the nerve cell works, like basically if you make contact with the dendrite, it'll trigger something, or is the dendrite attached to another cell?
Yes, you're getting ahead of me. That's okay. So let's take you touching your finger. Okay. There. I take my pencil and I touch my skin. In my skin, there are going to be touch receptors. And then those touch receptors will be connected to nerves. And then those nerves will then send that signal to typically, depending on what the response, depending on what the stimulus is, will determine where the impulse travels to, whether it travels just to the spinal cord or if it also travels up to the brain. Right, so then let's take hearing. What is happening in hearing is there are sound waves in the air, there are compressing the air that is then turned into mechanical stimulation in your ear. That mechanical stimulation is then turned into electrical signals. Those electrical signals are then transmitted to your brain. And then those electrical signals in your brain are interpreted. And then you understand what I'm saying to you.
So depending
depending
on
on
the, depending
depending on the
type
type of receptor will
determine
determine
what
what the response is. All right.
Any other
Any other
questions
questions about nerves?
Am I
Am I getting on your nerves?
All
All
right.
right, we have two
more
more
slides,
slides,
and
and
then
then we got a 10-minute break.
Hold on
with me.
Nervous tissue, made up
Made
of
up of
neurons,
neurons,
neuroglia.
neuroglia.
They're
They're
specialized to transmit and receive impulses.
Um,
I think
as long as you
kind
kind of know, as long as you know this bullet point right here. That's kind of what I'm gonna be asking of y'all
for the
the time being.
All
All
right.
right,
Last slide, then we'll go on a break.
Tissue healing. So when we get cut,
what's
what's going to first start happening is
clotting.
clotting. There are going to be, exposed vessels. The blood in those vessels will contain a clotting agent already. So we'll get some inflammation, inflammatory chemicals. You'll have some white blood cells go into the area. You'll have some clotting. Those fibroblasts are going to start laying down fibrin, which will then get turned into fibrinogen. We're not going to cover extensive tissue healing because there's literally an entire graduate level course filled with just tissue healing that I don't want to get into, that I don't think y'all need to know right now. Clotting occurs, epithelial cells multiply, go over that granulation tissue. That granulation tissue helps to restore some of that vascular supply. And then one. Once the after the granulation tissue has multiplied, restored vascular supply, you'll have wound contraction and restoring of that tissue to what is relatively normal. What is laid down is scar tissue, and scar tissue isn't as strong as elastic as original tissue, but it serves us well enough for our purposes. All right. Any questions about any of this before we go? Which types of the tissue is scar tissue? Scar tissue is a certain type of collagen that we're not going to get into. Any other questions before I let you go on a 10-minute break?
All right.
10-minute break.
Come back at 45.
We will have a short review then. No.
All right.
Let's do this.
Tim,
which one is this one?
Simple
what?
That
That is way too wide. Simple squamous.
Parker.
Next one. All
right.
right.
Grant,
Grant, I want the middle one.
Yep.
Yep.
Nope.
Nope.
Try
Try
again.
again.
There you go.
Andrew,
give
give me the right side.
There
There you
go.
go. Pseudo strat columnar.
See
See
ya.
ya.
This
This left side.
What is it?
Simple columnar.
I don't know.
I don't know how to spell columnar.
Bree.
Bree, what's this right side one?
Stratified.
Say with your chest.
Cuboidal.
Cuboidal. Mia, left hand side one.
Tim. Kayla.
Kayla,
What
what is this tissue? We'll give you its muscle. Okay, yes, it's found the digestive tract. Good. Second level. First level, what is it? Smooth muscle, yes. Chloe, give me this one.
There we
There we
go.
go. How can you tell? Compared skeletal to smooth.
Because it has
Stratified. Yeah.
Yeah, the white stuff in the middle.
Roz.
Roz,
Layup.
layup. What is this one?
There we
There we
go.
go. Cardiac muscle. All right, getting into it. Kimmy, what is all this blue stuff up here?
reticular fibers.
I don't know. Michaela, what is this big white thing over here?
The macro.
Yep.
Macrophage. Macro. Isabel, what are these kind of thin green ones over here? Where- One, two, three, four. Yep, elastic fibers. Tim,
What are these big ones right here? These gray ones.
Yep. Nope. I will highlight them for you again. Here. These big ones. What are these? Nope. Try again. Yep. What are they called? There we go. Parker, what are these big yellow ones? Adipocytes, yes. Um, Grant, these kind of bigger, I'll highlight these for you. These bigger fibers. Here's one right here. Yep, those are collagen fibers. And Andrew, what's this last one on here? Yeah, the fibroblasts. All right. Theo,
What are
what are these cells?
Top one.
Yep, adipocytes. Bree, what? What is this tissue? Dense, irregular, connective tissue. Let's see. Mia, what is this? Yep. Blood. Kayla, what is this? Yep. Connective tissue. All right. Let's see here. Chloe, what is this tissue? Yep. Plastic. Cartilage. Okay. Roz, what is this tissue? No, not fibrocartilage. Close.
It's one of the
cartilage. Hyaline. Kimmy, where can I find hyaline cartilage?
Yeah.
Yep. Michaela, where can I find elastic cartilage? Ears. No. Oh my goodness, I can't spell. Nose. All right. Almost done. Isabel, what is this tissue?
Yeah. Tim,
Where can I find fibrocartilage? And what are the discs in your spine called, since you aptly identified those? Give you a hint. They're between vertebrae. Yep. Intervertebral discs. All right, dense. All right. Grant, what is this? That's an eraser. What is this box pointing to? Dendrites, yep. Dendrites. Andrew, what is this one pointing to? This one. What is that long piece? The axon, yep. Axon and lastral. Theo, you'll finish us off. What is this big thing right in here? Nucleus? Yeah. All right. Any last, oh, you know what? Surprise. Never mind. We got two more. Review from last time. We'll do planes and then I'll pick a couple and we'll pick up with some of this review next class. Bree, what is this plane? Yep. Sagittal plane. And Mia, what is this plane? This point two. Yeah. Reverse. Plane. And Kayla, what about this last one?
What's another name?
What's another name for it?
Coronal.
Coronal plane.
Good. All right, that's it.
All right, that's it. We'll pick up
with this
with this last review
next
class. And
next
class is what? Friday.
All right.
Review next class?
No, like this review.
This review? Yeah, some of it will be on the quiz. You're welcome.
Back of her head to her nose. It's pointing at the one that's like going like that.
It's pointing at the one that's coming down this way, Kayla.
Yeah, that's what I thought. But the image was I heard you study. Oh, wait. How would you review?
Hold on, let me stop this.